Hi, I'm Dr. Rohini Paul. So it's part of my nursing skill tip. I want to talk to you about blood pressure checking. So we all think everybody knows how to check blood pressure. If you say that, in my experience, what I feel, we need to learn few more things, because blood pressure checking is a very important thing, very vital for a human being, for a patient. If I make a mistake, the diagnosis will be wrong. That is what. So I'll give you a few tips how to remember to do a proper checking of blood pressure. So what is this blood pressure which we talk about? So we all think there are two aspects. One is systolic pressure, another is diastolic pressure. We are thinking systolic is from artery, diastolic is from vein. It's totally wrong. Both systolic, the blood pressure is checked from the artery only. Artery carries pure blood. So what is that blood pressure is? See, your tube, your vessel, arterial vessel, where the blood is going, from the heart is pumping. There is a pumping stage, there is a relaxation stage. When the heart is pumping, contraction stage, the blood goes into the artery. So it goes in a high pressure, it goes and gets touching the artery of either side. That is what is called the blood pressure. That is what we always check in your arterial pulsation. So this is what it is. So what I am talking about, when you check your blood pressure, the systolic, it is when the heart is pumping, contracting, it goes and touches either every side of the artery, and it is giving you the systolic pressure. When the heart is going into relaxation mode, it doesn't go and touch. It is going in a very low speed. That is what it is, diastolic. So to check, there are few things as a nurse we should know. Where do you check? I check always on the brachial artery. That is in my upper arm, because here it's a single bone, so I get the exact thing. How do I tie this? When I tie the cuff as a nurse, you should know, when the arm is a normal size circumference, no problem. If you find the arm is quite a big, circumference is big, if you go with a normal length of the cuff, the patient will feel humiliated when it's going off, when you start pumping. So please realize 2.5 centimeter more length of cuff you should go with the patient. Please understand that. That is one thing. Then where do you keep your diaphragm of the stethoscope? One more thing I'll tell you. You all should know, without a stethoscope, you cannot check the diastolic pressure. So that is what part of our nursing procedure of checking blood pressure. Always stethoscope is there. So where do you keep your diaphragm of stethoscope? It is on the anterior. Anterior is front, posterior is back. You should use this anterior cuboidal fossa. So this you should know the terminology. So this is anterior cuboidal fossa. You keep your diaphragm. Where do you tie your cuff? It should be 2 finger, easy for you to remember. Then you tie your cuff. So that is one aspect. Again, how do you check this blood pressure? So we always have a tendency to take it up to 200. Never do it. When you start pumping, after tying, when you start pumping, it's very easy for us to remember. Start pumping. The time when you keep on, like my blood pressure is 130 always. After above 130, when I keep pumping, it stops. You have to stop there. You don't need to take it just like that to 200, 210. Please never do it. So when you stop hearing, you stop it. Then you release your screw. As you keep releasing, when it comes down, when it comes to 130, you start hearing the first sound, that is systolic. Easy to remember. Then you keep on hearing it. Again in one point, you stop hearing. That is your diastolic. That's all you have to remember. So don't just like that raise it. You keep pumping it. The place where you stop hearing, you stop it. Then start releasing the screw. As you keep one place you start hearing, that is your systolic. As you keep coming down, one place you again stop hearing, that is your systolic. So this is all 2 things you remember, all put together. That is all about checking the blood pressure. There is nothing beyond. So if you cannot do this, and one more thing again I'm repeating, without a stethoscope you can never check a diastolic pressure. I'm sure you can understand this better. Thank you very much.